What I really liked about urology is the ability to treat patients in a manner that gets them back to health as quickly and efficiently as possible without disrupting their way of life. My name is Chris Hartman, and I'm the Medical Director of Urology at Northwell Health. My clinical focus is urology. I do general urology by trade, with a heavy emphasis on endourology, which means minimally invasive surgery for kidney stones, mild ailments of the urinary tract, including BPH or an enlarged prostate, voiding dysfunction, which means incontinence and difficulty urinating. I do procedures on all different parts of the urinary tract, in the kidneys, the bladder, the prostate. But there's a misconception that urologists treat mostly men, and that's not the case. So there are certain conditions, kidney stones for example, that affect both men and women equally. Urologists treat incontinence in women through a variety of different techniques to get them back to health and back to their way of life that they didn't previously think was possible. Today we have the option of really focusing on patient-specific, patient-centered care. So what that means is performing techniques that weren't available even 5-10 years ago. There are newer techniques that we're employing to be able to care for the whole patient and get them back to health faster. We have a better way of diagnosing and evaluating an elevated PSA, and primarily looking for prostate cancer, called a transperineal prostate biopsy. Transperineal biopsies help to reduce the risk of urinary tract infection, as well as significant pain and bleeding. And at Mainline Health, we've committed to performing all prostate biopsies via a transperineal route to be able to offer patients these benefits and reduce the risk of the prostate biopsy in general. We've committed to using minimally invasive techniques of taking care of kidney stones. Kidney stone disease is an ailment that affects a large number of Americans. Now we have the opportunity to use advanced techniques where patients don't even need to have an incision, getting patients back to their regular activities more quickly and in a way that they can improve their health in a faster manner. We do have aquablation at Mainline Health. Aquablation is a new technique to take care of patients with an enlarged prostate. It is typically a more efficient robotic approach to performing BPH surgery, which reduces the risk of morbidity from some of our older procedures. So my patient philosophy of care really is to involve patients in their care to the greatest extent possible. I want patients to feel comfortable with me. I want them to know what the options that they have are that are available, and to really involve them in their decision. I truly take a vested interest in all my patients, and I laugh with them and I cry with them. And it's very gratifying when we see good outcomes. And for me to get to experience that with patients is really important, and it brings me to work every day, and it makes my job fun.